All right, Matt. Well, it is 2 o'clock. You want to go ahead and get started?
Yes, good afternoon, everyone, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the River Valley region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan. And I want to thank you for attending this afternoon. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or a smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation needs in your region, and your active participation is highly encouraged. When asking a question or making a comment during these times, please use the raised hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is the comment bubble icon. Our team member, Jaquita, will be monitoring the hand raises and chat box during the entire workshop. The 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and provide some background on rural and human service transportation in Georgia. I will then head off to Will Brewer from AECOM to review the available transit and transportation services in the River Valley region. After, Barry Bream from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple of question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Not many people may be familiar with those terms. Rural and Human Service Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to update the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from that first plan to identify projects, programs, and policies to meet current and future demands, and also provide enhancements to RHST services across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, or NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to the plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The RHST Plan 2.0 outlined coordination activities among the rural, public, and human services transportation providers across the state to achieve improved service delivery to the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we've wrapped up our vision and goals, which I will discuss on the next slide, and are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with a pink circle indicate the Technical Advisory Group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from the regional commissions, the statewide Independent Living Council of Georgia, and other stakeholders identified through our stakeholder engagement process. I'm very pleased to see a few of them attending the workshop this afternoon. We are also engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. And again, thank you so much for attending today. We are also conducting a statewide survey for RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of the RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the River Valley region. Will?
Great. Thank you so much, Matt. Good afternoon, everyone. And thank you so much for attending this afternoon. Yes, my name is Will Brewer. I'm on the consulting team with AECOM, and I just wanted to walk you all through your existing transit and human services and community health service areas. So this won't take too long. Kirsten, there we are. So if we zoom into the River Valley, I just wanted to start with your public transit service areas. And so what we have to start off with is for Muskogee County, we have Metra, which serves the Columbus area with 10 fixed routes and paratransit. We have a number of demand response rural transit agencies. I do want to acknowledge that there is a coordinated system with 3 different counties. That's the Lower Chattahoochee Regional Transportation Authority, and that is for Quittem, Randolph, and Stewart counties. That is rural transit demand response. There are also some demand response systems for Crisp, Dooley County, Macon, Sumter, specifically City of Americas, Talbot County, Taylor County, and the remaining counties in the region actually do not have any transit services that we know of at this time. That'd be Marion County, Harris County, Shelley County, and Chattahoochee County. And if you can see the maps, those are the ones that are highlighted in white.
Will,
I'd like to,
this is Jim Livingston. I know Carrie Anderson's on the call. We do have
sure.
some updates for Harris and Chattahoochee, who will be joining the Lower Chattahoochee Regional Transit Authority. So
Oh,
that's
great.
an ongoing effort there. So those two loops at least will be closed.
Absolutely. No, that's great to know. Thank you so much. And that's another item I was going to bring up as we go through the existing conditions in current service areas. This is something that, we're hoping that all of our stakeholders and the public can get involved with and see, what kind of data that we have and what's correct, what's not, what are we missing. And we're going to get there in a few moments when I hand it over to Kirsten. But thank you so much for adding that. It's good to know. So we're making notes as we go through this. I guess I will just keep on moving forward to human services. So as far as we know, that the region's rather well covered with a few different parties that are involved. That's the Division of Aging, Division of Family and Children Services, and the Department of Behavioral Health and Developmental Disabilities. And so we have various counties that do have those services provided to them. We could show them there on the map, and Kirsten's going to revisit this here in a second. As far as non-emergency medical trips, those trips, for medical treatment, medical evaluations, obtaining prescription drugs, obtaining medical equipment and whatnot, the county is, excuse me, the state, there are 5 different regions across the state and 2 brokers that provide those services, Motive Care and Southeast Trans. And in this case, this particular region does fall within the Southwest region, and Motive Care is that primary broker that provides those services for those types of trips. And we could talk a little bit more about that. But really, that's just, the snapshot that I want to provide for now. And I think we're going to go over this a little bit in more detail. And Kirsten, I'll let you take it from here.
Okay. So this is kind of the first break where we want to get input back from you all. We do have an exercise. So for those of us, or for those of you that are joining us by computer or smartphone, or have access to a computer or smartphone, you can join us through a polling tool called Menti. So you can go to www.menti.com, or you can take a snapshot of the QR code on your screen. If you are joining us by phone and do not have access to a smartphone or computer, I'm going to ask the questions out loud, and while people are responding, if you have a response, you may unmute your phone and respond to it. So once you get to the website, again, that's Menti, MENTI.com, it'll prompt you for a numeric code. There's an 8-digit code. The 8-digit code is 876823220. So I'm going to pause there for a second, leave this up here. The code will remain at the top of the screen for these questions in case you need it for reference. So the first question, based on the maps that Will was showing, and I'm going to go back to them and talk a little bit more about them, what transportation services are we missing? We heard from Mr. Livingston that Harris and Chattahoochee counties will be joining the Lower Chattahoochee Regional Transportation Service. And so those are the types of things that we're looking for. Other things that we may be looking for. These maps do not indicate any private transportation services that may be operating independently from GDOT, DHS, or DCH. These may be nonprofits like faith-based organizations that are providing transportation services either to their congregations or maybe to a specific group of people like seniors. So one of the responses is that there are multiple counties still missing 5311 service. That's the public transit service. And working closely with Metra. So while other people are thinking about it, let me go back to the map so you can reference them and kind of see what's being provided and what isn't. So there are several counties that we're showing do not have any sort of rural transit available. And then there are a lot of them that provide demand response. On the human services side, there are 4 counties that we're showing do not provide aging services, aging transportation services through DHS. Those are Quitman, Webster, Sly, and Talbot. We want to make sure that we're reflecting this information accurately. So if you see any errors in these, that's the kind of information that we want to hear. So if if anybody wants to vocalize their responses rather than the Mentimeter, that is totally fine as well.
We'll confirm that. Savannah, I know you're on the call. We'll get the confirmation. There are a couple that are on there that I'm not sure should be, and a couple that it should be on there that aren't. So
Okay. Okay. Yeah, that would be great if you could help us, because that's really the basis of this. We want to make sure that we have the existing information correct. As I think we're all aware, there are 159 counties in Georgia, so it's a lot to stay on top of, especially when you have all these single operators. Any other comments, concern, transportation services that we may be missing? I think we're going to get some confirmation. Okay. So commuter services from rural areas to city centers, especially Columbus. So I'm assuming that that is a service that does not currently exist, that we're not reflecting, and is something that is needed, something that the region is missing currently, and there's a demand for. Is that correct? Or are there current commuter services from rural areas to Columbus currently?
No, there are not.
Okay. Workforce trips. This is one that we've heard a couple of times, is that there are not any services specifically for workforce, that is a coordination between the 5311 rural public transit services and perhaps employers in the area. And so I think this is an area where service could be expanded, or perhaps there could be a program in place specific for workforce trips. Apprenticeships is one that we heard from the Central Savannah region this morning. Okay, let's move on to the next question. Again, this is not your only opportunity to speak up. If there are other things that you think of that are missing, there's going to be plenty of opportunity. Also, as we continue to go through the presentation, if you'd like to enter your comments into the chat box, you may do so. Jaquita is monitoring those, and if you would like to speak, you can raise your hand at any time. We will have another break after a few slides to answer those questions and those raised hands. So the next questions. So thinking about the existing system and the existing transportation services that are out there today, what are some of the constraints that you're seeing on the existing system, either from a provider perspective or a rider perspective? And I think what we mean by this is, you may be operating a service, but you're finding that you can't operate as many days per week or as many hours in a day as you feel you should. So something we've heard from other regions is that transportation services are not provided late into the evening or overnight, and therefore they cannot provide rides to third shift employees, especially in areas where you have manufacturing, warehousing, and distribution, where operations are 24 hours a day. Maybe your constraints are just, we need more funding. Maybe your constraints are our vehicles are old and we can't get new ones. Maybe some constraints are on your workforce. We've heard that quite a bit, that there's a driver shortage of qualified personnel. And that's something that we're certainly seeing a trend for. Hours are limited, drivers are limited, and there are long distances in the region for trips. That is also something that we heard. In some of these more rural areas, these trips can be very long and take up a lot of the provider's capacity to provide more trips. So what are some options to solve those long trip challenges? What other constraints? What are your gripes? What What keeps you up at night? Okay, so your trip rates, yep. The fares that you're charging are not enough to offset expenses for some of the providers. So where do you fill that gap? Where are some other sources where you can get money just to provide the service that you're providing today without raising the price of on your customers? Another comment, there's not enough non-emergency transportation drivers, and trips that are booked are being canceled, and people who are making reservations are not keeping their reservations. That's a big issue. You spend all this time scheduling out where your drivers are going to be and where they're going to be going to, and when they've got to be there to pick up, and then you get these cancellations, and now you've got to reshuffle your drivers. And I know with non-emergency transportation, there's a lot on the performance, the on-time performance for those providers. So that's really critical. I'm not sure who provided that comment, but do you feel like this is an ongoing problem, or this is a problem that has become more of an issue during COVID? Yeah, Angela?
That was my comment. And actually, I didn't type it in right, so it's misunderstood. I'm a nurse with Children's Medical Services. So it's a Department of Public Health program. And so we service children birth to 21 with chronic health conditions. So there are no specialist providers in this area. And they all have to travel to either Atlanta or Augusta for specialist care. So what I meant by that, I've had an uptick in parents calling me from this area that their trips are being canceled. There are not enough drivers, and all of their trips they've already scheduled their reservations. Their kids have an appointment, and those trips are being canceled because they don't have enough drivers, or a driver just does not show up. So I've had, it's a definite uptick. Actually, this has been recent.
Okay.
Like I would say in the last just couple of months.
Yeah, I mean, I think that's something that we're hearing across the state, is that transportation providers are losing drivers because they can't pay the drivers what other industries are paying. I know I don't want to steal Baird's thunder, but one of the things specifically that we heard was they're losing drivers to fast food jobs because fast food jobs are paying more than they can pay the drivers.
This is Matt. I wanted to jump in. I have a quick follow-up question, and this is a very interesting issue you bring up about the DHS trips. Are these ambulatory trips, or are these wheelchair or bedside trips? Just curious.
The majority of the ones on my program are wheelchair. Your kids in wheelchairs. Mm-hmm. Okay,
I asked that just DCH and Motive Care, they sometimes use TNCs for long distance trips, as like Uber, Lyft, and some others. So I was just curious if they were specialized transportation services needed for that type of trip. So it sounds like they need a vehicle that has wheelchair access.
And then I wanted to jump in, and there's a comment in the chat box from Savannah that says we have DHS services in Talbot County. This was the only county not highlighted. Harris and Chattahoochee do not currently have DHS services, but they will once they are added to LCRTA. Macon and Marion counties are not currently using DHS services. There are not any of those types of trips performed in either county.
Okay, we need to document that one.
And again, that comment is from Savannah Brown.
Yeah, and Jem, I think that's what you were alluding to, that you thought that there were some counties that had service that we weren't showing, and some that were showing have service that actually don't.
Yeah, Kristen, we'll get you and Savannah together to get that squared away.
Perfect. Thank you so much. Okay. So there's a couple other responses. This is a difficult program administratively, and it's hard to keep together with limited dollars. I agree. This is it's complicated, and these are very large service areas. So I'm just thinking out loud and want to get y'all brainstorming too. When we kind of get to the end, I would love to hear some suggestions of how you think programs could be improved to operate more efficiently. That was one of our first goals. Maybe we need to have, you know, smaller service areas. Maybe no, maybe there's, I mean, obviously we want to look for more coordination. I know the dollars are limited, so I think that there's going to be more funding coming down from USDOT through the bipartisan bill. I don't know how much there will be or how helpful it's going to be. But we really want to hear from you what would make your job and your life easier trying to keep these programs together. And another constraint is writer eligibility. So people may, and again, let me know if I'm wrong. People may think that they're eligible, and then they go through the process of getting getting approval, and then they find out that they're ineligible for those services. Okay. So like I said, we're going to have more time a little bit later. I'm going to keep the presentation moving. We're all done with the Mentimeter and the polling. The rest will just be kind of discussion based. So you can close out of the Mentimeter. These are logged, so we've got a record of them. And so I'm going to turn it over to Mr. Baird Bream with Cambridge Systematics. They're doing the needs assessment analysis, which is based on trip information in this region. He's going to talk to you about some of the gaps that we're seeing. And then he's also going to cover some of the things we're hearing from those surveys that we talked about.
Thank you so much, Kirsten. Yeah, we are happy to present our preliminary findings on the needs assessment for the River Valley region, looking at rural and human services transportation demand throughout this region. We are using a methodology for this study that is consistent with a methodology that GDOT used for its 2019-2020 statewide transit plan. This will allow us to kind of compare the findings of the two plans and see if there are any kind of lessons learned or significant changes that we should be noting and moving into our recommendations. Additionally, the methodology used in both studies is itself based on a methodology prepared by the Transit Cooperative Research Program, and that the TCRP has recommended as kind of a best practice in analyzing and estimating rural transit demand. So we're pleased to be using this methodology. We are confident in its reliability and its robustness for answering some of these critical questions. Next slide, please. So the main way that methodology operates is to essentially conduct two assessments, the non-program demand assessment, which is highlighted in this table in blue, and the mobility gap demand assessment, which is highlighted in this table in green, to estimate transit demand based on certain demographics and travel behaviors. The non-program demand assessment looks at demographics within each county and aggregates them to the region. So specifically looking at demographics of transit-dependent or transit-reliant populations, namely people ages 60 and older, people with disabilities, and residents of zero-vehicle households, by which we mean households where the people living there do not have consistent and reliable access to a private vehicle. This non-program demand assessment analysis is considered the lower bound assessment for estimating transit demand in this region. It essentially helps us set a minimum value. The mobility gap demand assessment takes a similar approach, looking at the demographics of transit-dependent or transit-reliant populations, but analyzes transit demand through the lens of travel behavior rather than just demographics. So the mobility gap demand assessment specifically focuses on the difference in the number of trips taken per day between zero vehicle households and one vehicle households. So essentially comparing travel behavior between people who don't have consistent access to a vehicle and people who do, and then analyzing that gap in travel behavior to build an estimate of demand. And the mobility gap demand assessment is seen as the kind of higher bound estimate, the one that takes it helps set a maximum level of transit demand for us. The data from this, these demographic data points that I mentioned earlier, are taken from the American Community Survey, which is prepared on an annual basis by the U.S. Census Bureau. While the survey is issued or conducted on an annual basis, there's a lag in the availability of data just based on the data cleaning and analysis procedures that are necessary. So as a result, our base year for this analysis is taken from 2019, and that 2019 data for the ACS demographics is aligned with the 2019 transit data that the service providers in your region would have prepared and submitted for the National Transit Database. That just allows us to have a kind of consistent year-to-year comparison. We also do a long-run projection with a horizon year of 2050 to assess how transit demand will change over time. And this 2050 horizon year uses population projections to estimate the demographic changes over time. And those projections are taken from the Georgia Governor's Office of Planning and Budget, which produces population projections for every county on an annual basis between 2020 and 2065. So what we see when we conduct this analysis is that the estimated rural transit trip demand across all counties in the River Valley region ranges from a minimum of about 108,000 per year to a maximum of 512,000 per year in 2019. This is compared against the total number of rural transit trips provided by all providers in 2019, which was 133,000. So what this means is that based on this estimated projection, the current level of transit service across all providers in the region is exceeding the minimum, and there effectively is not an existing gap in rural transit coverage between what is demanded and what is provided. However, that's the minimum. On the maximum, where the estimated rural transit trip demand is 512,000, we see a gap of about 379,000, which means an additional amount of service necessary to provide 379,000 trips would be needed in order to meet that 100% of that demand. In the final row in this table, we estimate the total annual costs, both capital and operating, that would be needed to meet 100% of the demand. So this is essentially estimating what it would take to fill that unmet rural trip demand. For the non-program demand analysis, obviously, since the current level of service is exceeding that demand, there's no additional funding necessary. And what's presented here is the $2.8 million that it takes to essentially operate and maintain all the transit services across the River Valley region. However, under the mobility gap demand assessment, that amount, that total annual cost increases to $14.2 million per year. Now, we know that may seem like a lot, and what we want to stress is that this analysis is not a recommendation. It's just an assessment of need. And specifically, it's a very maximalist approach to analyzing need so that we can get an understanding of just how much demand there is and how many more resources would be necessary in order to meet 100% of it. Similarly, we see a broad range in future transit demand in 2050. Now, the River Valley region is projected to lose population between 2019 and 2050. So transit demand is projected to decline slightly, going down to about 96,000 trips per year under the non-pro. I'm sorry, is there a comment? Okay, sorry, I'll continue, but if anyone has a question or a comment, feel free to chime in. We will also pause for questions after I complete the review of the quantitative assessment, so there will be additional time. And then under the mobility gap demand assessment, transit demand is still, significantly higher than compared to the non-program demand assessment, but it still declines to about 451,000 by 2050. And this means, again, that meeting 100% of that demand has a cost of 2.5 million for both capital and operating costs to 12.9 million. We'll go on to the next slide. There's an additional form of quantitative transit demand assessment that we conduct for this needs assessment that looks a little different from the ones discussed on the previous slide, but it does capture some of the transit demand need that folks actually discussed earlier when we asked about missing services. And that specifically is the commuter transit demand assessment. The commuter transit demand assessment is essentially an analysis of inter-county travel, specifically recognizing that there's going to be some amount of inter-county travel within every region, just based on the economic relationships between counties. Some counties have large residential populations. Some counties are home to larger job centers. So there's going to be a flow across county lines. And we want to see what level of demand or travel flow between those counties could be captured by transit or provided by transit. Now, the way we do that is with a proxy estimate of commuter transit demand based on the number of home-based work trips, essentially people who are working from home. The reason we use home-based work trips as a proxy is that the home-based work trips essentially represent trips for work that are not being met by another transportation mode. So if someone who worked from home wanted to go into the office, conceivably they could do so via transit. And we we use that estimate to estimate travel demand. That information is taken from a combination of sources, an additional U.S. Census database source, and then the GDOT travel demand model, which is a model that GDOT uses to estimate trip behavior, trip demand, and travel patterns throughout the state. Now, obviously, every county has some degree of flow back and forth across county lines. Everyone works elsewhere. Everyone has needs that need to be met across county boundaries. But this commuter transit demand estimate sets a threshold value of 100,000 trips per year. That is done in order to kind of set a minimum level of demand that would be necessary in order to sustain the capital and operating costs associated with commuter transit. So what we see when we run these numbers is that there's a fair degree of commuter flow between Harris County and Muscogee County that crosses that 100,000 trip minimum. And in 2019, that annual commuter transit demand volume is about 159,000. And by 2050, that actually grows to 292,000 annual transit trips. This reflects the fact that these Harris and Muscogee counties kind of represent two large centers of activity that, even though the region as a whole is projected to lose population, these two counties are likely to gain population and grow in popularity, and so transit demand will likely increase over time. So we do see a viable market for transit demand or for commuter transit service there, which we will be exploring further. I will pause there because that's the quantitative component of this. We'll move on to the qualitative component in a minute. Just want to see if there are any initial questions, comments, feedback.
Okay.
All right. If not, we will move on. If anything comes up later, again, we'll be opening it up for discussion. We're happy to take additional questions. But for now, we'll move on to the qualitative assessment. So the qualitative assessment is based on the provider and rider surveys that Matt mentioned earlier. These surveys are our effort to hear directly from our stakeholders, both those who provide and administer the transit service and those who use it or might use it, in order to get some more nuance into the needs and priorities for transit in the region. As was mentioned, both of these surveys are still open through the end of the month. If you haven't taken them yet, we encourage you to do so. If you have taken them, thank you for your participation. We would also welcome you to encourage you to share the surveys with your peers, your colleagues, your constituents, whomever. You know, the more the merrier on these sorts of things. So to start with the provider survey, we've received 36 responses to date. And in this survey, we asked for a variety of input on the current conditions and the challenges that agencies are facing, as well as what they're thinking about doing in the future to improve service. So slightly fewer than 50% of respondents indicated that they are able to carry riders outside of jurisdictional boundaries, and 2/3 of respondents indicated that they have not pursued coordinated human services transit or regional service. This is consistent with what we see with a lot of rural transportation. You know, we recognize that these are small agencies dealing with, you know, significant administrative burdens. Taking on additional administrative responsibilities to manage regional service isn't easy. So we're cognizant of the challenge that is posed by these opportunities. Many agencies reported having less ridership in 2020 than in 2019. Namely, 6 respondents indicated that they had fewer than 5,000 trips in 2019, but this increased to 10 for 2020. And we really see this as evidence of the impact of COVID-19 that the pandemic has had on the transit sector across the entire nation. You know, obviously, the economic impacts of COVID and the disruptions to daily life meant that a lot of people weren't able to go to places where they wanted to. Either, you know, they had lost their jobs, or places had closed down, or there were restrictions on access to these places, and so, you know, fewer trips were being taken. And of course, tragically, we have to acknowledge the loss of life as well that happened under the pandemic, which meant that a lot of these agencies may have just lost some of their riders. But we recognize essentially the fact that agencies are kind of starting on their back foot as we put this plan together, that they're still in a kind of recovery mode coming out of the impacts of COVID-19 and trying to rebuild that ridership. We asked agencies to indicate what sort of technology they're either currently using or thinking about using as they look to their future. And what was most interesting to us is that we heard that while only 2 respondents currently use a smartphone app or a website for trip planning and fare payment, 8 agencies are considering adopting this tool. We're glad to hear that, you know, the sort of technology-centered trip planning, integration of technology into how the riders can use the service is definitely a great opportunity. It has created a lot of meaningful improvement in accessibility and mobility for customers. So we're happy to see that. We also asked about challenges, starting with the most common state of good repair needs. And what we heard here was an interesting mix of traditional issues and more emerging issues, because the top-rated challenge for state of good repair was purchasing new vehicles, which is the perennial challenge of a rural transit service agency, is just making sure that they've got the vehicles in the best condition that they can be in order to keep that service reliable. However, the second highest is establishing regular maintenance schedules. What we heard here is that several agencies rely on or essentially share their maintenance staff and their maintenance equipment with other transit providers in the region or with other county governments or municipalities, essentially meaning that they're not able to schedule their maintenance when they want, but rather have to coordinate with other agencies, which can impact the agency's ability to have their vehicles repaired on time and returned to service, which then impacts the reliability and consistency of the service. And what we hear there overlaps with some of what we've been discussing earlier, which is, of course, the workforce shortage that has really, hit many sectors. Kirsten did indeed steal my thunder by talking about the challenges with, losing drivers and mechanics to fast food restaurants, but it just speaks to the scope of challenge, that, agencies aren't competing just with each other, they're really competing with many other sectors of the economy and trying to ensure that they have regular access to drivers, to mechanics, will likely be a significant challenge moving forward. That came up again when we asked about the most significant challenges in 3 areas: administrative, rider demand, and funding. Because again, that administrative challenge, the most common administrative challenge was attracting and retaining qualified personnel. So it's, again, it's really at the top of transit providers' to-do list, is ensuring that they've got the drivers that they need. The more traditional administrative challenge that we heard was compliance with state and federal reporting, which again, we're seeing all across the state and really all across the sector for rural transportation. Again, these are small agencies that have to deal with large administrative burdens, and it takes time to get through all that paperwork. On rider demand and satisfaction, we heard that the 2 most significant challenges were expanding service into new markets and ensuring that transit is able to go to where their riders want to go, but then also dealing with the public perception of transit, which again is kind of an interesting mix of traditional issues and more contemporary issues. Rural transit is often seen as something only accessible to people with disabilities or people with mobility challenges or the elderly, when in reality it can be for everyone. It can play a role in everyone's lives. But beyond that, there's also the concern now, again, through COVID-19, that transit vehicles are no longer safe, that being in an enclosed environment or an enclosed vehicle with several people poses a direct health risk. So again, we're trying to be mindful of that as we put together strategies and recommendations for this plan, that we need to address the perception of transit and need to help on the marketing and outreach for bringing people back to transit. The most significant funding challenge was securing local capital funding, which again, we see as a pretty consistent challenge with rural transit, that a lot of these small providers are operating in small counties where the governments are running pretty lean operations, and finding the funds to make those long-term investments can be a real challenge. We'll move on to the rider survey on the next slide, where we've received 55 responses to date. And interestingly, we've noted that 85% of respondents do not currently ride transit. Obviously, it's valuable for us to hear from people who are not riding transit, because we want to understand what the limitations of transit might be, or get insight into why they think they can't or shouldn't use transit, why it might not be for them. But we also want to ensure that we are hearing from a good number of our current riders, so that essentially we're able to understand their needs and priorities as well, and continue to maintain a high quality experience for them as they use transit. Among those who ride transit, their main reason for riding is that they lack access to a vehicle, and their most common trip purposes are work, medical appointments, and dialysis appointments. So what we see is, transit is meeting a wide variety of needs for these riders, and it's meeting very time-sensitive needs. We got to get to work on time, we got to get to the doctor's appointment on time, dialysis appointments are precisely scheduled. It all highlights the need for a kind of consistent and reliable service. We did hear from folks who ride transit that if it were not available and they had to find an alternative, they would get a ride from a friend or a family member. Again, something very common in rural transportation spaces, that people will tap their social networks to find the mobility that they need. That's great. We're glad to know that people do have options, but because that's not always a seamless process or a convenient process, we want to try to make transit as attractive and as convenient for as many service trips as possible, in order to give people that greater degree of freedom for their own mobility. Among those who do not ride transit, Their most common reasons for not doing so are that they are interested, but transit is not convenient, or that they are simply not interested. That last point is an unfortunate one. Again, it speaks to the marketing and outreach challenge that we have here, that people don't see how transit can be a value add for them, how it can improve their lives, and it speaks to an area of improvement in our messaging. Among those who do ride transit, their most frequently selected challenges for using rural and human services transportation is that the transit service does not go to where they want to go, the distance to the nearest transit service is too far, and unfortunately that it's not reliable enough to use for time-sensitive trips, which again definitely overlaps with the fact that they're telling us that their needs are extremely time-sensitive. Work, again, getting to work, getting to the doctors, getting to dialysis. But related to that is, of course, the coverage issue as well. When transit does not go to where they want to go, or the distance to the next transit service is too far, we start to imagine the gaps that may be emerging for people when they think about getting to where they need to go, when they think about those kinds of cross-county trips that we were discussing earlier. To address some of these challenges, we asked what sort of transit improvements our transit providers should prioritize. And what we heard is ensuring that these transit agencies are providing access to jobs and providing access to healthcare, and also connecting different parts of the community or region. So essentially the mirror of those challenges is where these riders want to see improvements. We also asked them for input on which transit technologies they want providers to prioritize as they think about their future. And what we heard was that the riders want real-time arrival information at transit stops, as well as real-time arrival information available via smartphone, website, or text. So again, transit riders want the tools available to them to help plan their trips more efficiently and effectively, and ensure that they're able to use that service more consistently and reliably. So we're really pleased with what we're hearing so far. That concludes the qualitative input. Again, both surveys are still open through the end of the month. We encourage you to take them and to share the surveys with your peers, colleagues, and constituents.
Thanks, Baird. So that concludes the presentation piece of this workshop. We want to use the rest of the time. I've got more questions for you, but we also want to hear your questions and concerns and suggestions of what you feel we need to be thinking about with this study. This is the opportune time to provide your input. As Matt showed in the schedule, we're kind of wrapping up the existing conditions and needs assessment. We're going to be compiling all of that information, and then we're going to be coming up with those projects, programs, policies that should be considered as a part of recommendations out of this plan. So we really want your help informing that process, and now's the opportunity to do it. I will say that we will be taking additional questions and comments through March 4th, which is a week from this Friday. And you can submit those to Matt at his email, which we will provide to you at the end of this presentation. So just as a reminder, if you would like to speak, please use the raise hand button. Chiquita will call on you. You can also enter your questions in the chat box, so we'll be checking those. If you are calling in by phone, please feel free to unmute yourself at this time, and please just kind of interject and let us know that you have a question. Chiquita, I think we have a comment.
Yeah, I'm here, right here. Will this PowerPoint be available after this presentation so that we can share with other stakeholders, especially the surveys? And I can start by saying, yes, it will be available. Kirsten, if you want to pick it up from here.
Yes, so both a copy of a recording of this workshop as well as a copy of the slides that we're presenting today will be available on GDOT's website. We have the link for it for you. They should be posted either by the end of this week or very beginning of next week for you to share with colleagues and others in the region. So I'm going to kind of jump in. I just want to get you brainstorming. I've got plenty of questions I can ask, but this kind of gets you thinking. So the first kind of set of questions are about your service area and connections. I'm really excited to hear that service is expanding to a couple new counties in the region, and I think that that is really great progress. Outside of those expansion areas, what other connections are missing? I think one of the comments was that commuter service is missing. We showed that there's some demand between Harris County and Muskogee County. But I'm interested to hear from you all. What are some other interregional connections that we need to be thinking about? Are there other counties that could benefit from some sort of commuter service? Or are there any areas that you feel maybe there is a demand response service, but because it's so remote and the trips are so long, there's a certain part of the region that just isn't getting coverage like it should?
I think a lot of this region does come to Columbus and to the transfer station here in Columbus, but there are parts of the region that will go to Macon. And so that's one of those, especially for the eastern parts of this region, Taylor County, Dooley County, Crisp County, Macon County. You know, some of their more logical trips are into Macon and sort of making sure we can talk inter-regional, but we want to be able to talk externally as well.
That's a great point. Great point. Specific to this region, and I think maybe I'm more curious than anything. Several years ago, I worked on a feasibility study for some sort of commuter rail or high-speed rail service between Columbus and Atlanta. Generally speaking, do you all feel like there's still a need for some sort of intercity connectivity between this region and the Atlanta metro region? You feel like there's a lot of trips
I've
back and
had a
forth?
few, sorry.
Sorry.
I've had a few instances with human passenger transportation not being able to get individuals from Columbus to Atlanta for specific doctor's appointments or specialists that are in that area that aren't located near them. Finding a transportation provider to make that long distance trip has been really difficult.
And again, are those trips, specialized where specialized vehicles are needed, ones that have, wheelchair lifts?
The previous client I was working with did not need a specified
Okay.
wheelchair trip.
So just general trips.
And this is Matthew Walsh chiming in on the Columbus to Atlanta. I think a high-speed rail would be amazing. I know that there's an independent company, Groom Transportation, that provides airport shuttle service between Columbus and Atlanta. But something that would link Columbus to, say, the MARTA system in Atlanta would be incredible. I know as a resident, I absolutely hate driving in, around, or anywhere near Atlanta myself, and I know there's a lot of demand for the various events that occur in and around Atlanta. I think it would be well utilized and provide an additional option instead of traveling by personal vehicle or otherwise. So having some sort of public transportation between Columbus and Atlanta would be fantastic.
Okay, great.
Yeah, Kirsten, Pam Hodge, the deputy city manager, just got off the call right as you asked that. But I think Columbus would absolutely echo, is very much interested in that.
Okay.
Yeah, this is Connor Miller with the Columbus Chamber of Commerce. I just wanted to add that I've heard from multiple nonprofits that that would be a big help for a lot of their the people in poverty that they serve and things of that nature.
Okay. It's good to know. All right. Keep those comments coming about missing connections. I think it's great, having connections to Atlanta, to Macon. This is a very important region for Georgia, where it's located, its proximity to other major cities in the state. So,
Hey, Kirsten, I want to add really quickly, John wrote in the chat box that he was glad to see in section 4.2 of the statewide transit plan that enhanced pedestrian, bicycle, multimodal transit accessibility is identified as a rural transit need. Smart bike pedestrian integration can help with first mile, last mile issues for able-bodied users. And again, that's from John Morgan.
okay, thank you, John. Yeah, we heard that in one of our previous workshops. I can't remember which one it was, but I think that that's something that is just kind of overlooked, especially when you have transit that operates fixed route where there are bus stops that things that I think we would all quantify as necessities or sometimes categorized as assets. And I think that they get overlooked, and one of those is providing adequate transportation or infrastructure to and from those stops. So thank you for that. So I want to kind of switch gears a little bit and talk about coordination. I'm really interested to hear the experience of trying to bring on 2 more counties into your regional system. Obviously, a coordinated system is an option for your region. You've started one, you're expanding it. But I'm really interested in what have been some of the challenges, what have been some of the barriers, or what are some lessons learned from going through this process. And it sounds like you're still going through the process. So I'm interested to hear any comments you have on the coordinated system.
Carrie, you want to comment on that?
Jim, I'll let you do that since you did a lot of the legwork for that.
We're really pleased to be able to get Harris County and Chattahoochee County with some transit services. We know, and the counties know, that they're too small, even Harris County and Chattahoochee County, counties with fairly robust budgets relative to some of the other counties in our region. They know that they need to be able to share the cost burden. And thankfully, the LCRTA board is willing to do that. And I think that's something we will look to continue to do. It's been, we've tried to under promise and over deliver to this point, but it is taking a day to get vehicles and get everything sort of set up on that. And I know there's some folks that from RMS that may want to weigh in on that too.
Yeah, so when it comes to the cost, and maybe you know the answer to this, maybe you don't, is the cost sharing at the local level proportionate to whether it's population or size of the county, or does everybody pay in an equal share?
We're setting this up as proportional.
Okay. It's good to know. And does this service, or will this service provide multi-region trips, like from Harris all the way down through Muskogee into Chattahoochee County?
I'm not sure that there would be reason to do that.
Okay.
I don't know that that's been contemplated. I think reality is most trips would be coming into, the reasons, whether it's medical or shopping or whatever, that's typically been in Muskogee.
Okay. But you do have the ability through this regional system to cross those jurisdictional boundaries and go into Muskogee County.
Carrie, do we have the ability to do that?
Yes, you have all ability to do that.
Okay. Okay. That's good to know. I know that's one of the biggest barriers for some of these smaller operators. Like they can't go outside of their county, and like how do they overcome that so that they can provide some trips to the shopping and the services and the medical and the workforce and all of that without having to, coordinate some sort of transfer at that county boundary line.
And Kirsten, from my experience, I work with the 5311 program with GDOT. It's mainly the counties that limit themselves in that way.
Okay.
Like a lot of our very small counties, a lot of times they will go outside because they may not have doctor's offices there in the county. Sometimes a little bit bigger counties, if they have a lot of services in that county, they choose not to go outside. Or small counties that have one or two vehicles, they may not just have the ability to go outside, but it's a county decision.
Okay. That's good to know. That's helpful. What has been some of the challenges of, and maybe there's somebody from DHS on the phone, maybe not, but considering that there are some counties in this area that don't have DHS coverage, what are some of the reasons for that? Do we know?
I think a major reason would just be the lack of a senior center option in the county. That's typically what I've heard and seen kind of play out, where there's not an option to go to the senior center daily and do the activities there. There's not really a DHS presence in the county.
Mm-hmm. Okay.
Some of our counties are very, very small. Just a
Mhm.
couple thousand people.
Sure. That's tough, like how do you, like they still need transportation, right? But how do you make the economics work of providing that transportation? Okay. I've got one more slide of questions, and these are just kind of administrative. Um, are you, I remember seeing one of the comments is that the fees that are being assessed to riders are certainly not covering the operating and maintenance costs. And there's still a challenge of finding that gap funding to cover all of the expenses for these providers. Are you all experiencing that you may have to raise fare costs, or is that like completely out of the question?
At least on the DHS side, we've got to. I don't. We're going to. We're keeping this together with baling wire and duct tape, and we're going to have to raise costs because it can't sustain itself, in my opinion, as it is.
Okay. Are you all experiencing, some of the labor shortage needs that we talked about? I think I saw somebody say that there's a lack of drivers. We heard that rides are getting canceled by the providers because they just don't have the drivers to provide those specific rides. But are you finding it hard to retain drivers and other positions? And is it just because of money? Like it's just too competitive that they can find higher paying jobs elsewhere?
The RVRC is, we don't hire drivers ourselves necessarily, but that is an ongoing issue I've heard from the subcontractors that provide transportation for us. That the reason they have to stop certain services or limit their time that they can provide is because they don't have the drivers or the resources to do that.
Okay.
I would say that's probably the main concern that I've heard recently. And
Okay.
some of the complaints that we've gotten have been because of drivers or being late to picking up clients or being late to drop them off back home. And they have all cited just because they stretched too thin and they don't have enough people to cover other areas.
Do y'all or does anybody assess penalties on third-party operators that don't meet on-time performance?
DHS has a formal complaint process that we go through, that if someone submits a complaint to us, we go through and kind of investigate that complaint, and do like a resolution with DHS.
Okay.
Outside of that, with normal customer service complaints, I'm not too sure.
Okay. Good. And you know, the big question, if you had $1 million, like if we just, if GDOT just gave you $1 million, right? But if there was $1 million available to you, how would you spend it? Where would you put that money?
Do you have $1 million to offer?
No, not me personally. I do not. But if we were able to find some cash somewhere, somehow, and we were able to distribute it, I think what we're trying to get to is, what are your priorities? If we somehow do find some money, where does that money need to go? And there's a lot of things it could go to.
We've got to shore up our system. I mean, we will not sustain ourselves long-term without shoring up our existing service.
Okay. And do you feel like, to sustain your existing service, is it just your operating expenses, or does it also include like some capital needs as well, like vehicles, maintenance facilities, or is it like just paying the day-to-day expenses of labor, fuel, the maintenance of the vehicles, that kind of stuff?
Kelvin, I see you on the call as well. I don't know if you've got anything else to add on this, or anybody from RMS that would be able to answer those questions better.
Well, Jim, I think clearly, can you hear me?
Mm-hmm.
Yes, I think clearly we're looking at expanded vehicles. I think across demographics, we have our seniors covered somewhat. We've got, we certainly got diversification in citizens needing a rise for employment. As you know, we, in the booming metropolis of Macon County, we don't have shopping facilities, so we just things as basic as food shopping out to a Publix or a Kroger. So we need capacity in our area that's economic. And as we look at this supply chain economy that we're in with the type of inflation, we're having a tough enough time just getting people to medical appointments. So.
Okay.
You know, and then I'd like to certainly see an expansion in the technology. You know, anytime we can get some level of surveillance, we want people to have some privacy, but we do need to know, as behavioral changes may occur and things happen, we need to be able to report out and have there be a level of accuracy that we can see around responsibility, who's culpable, minimize county risk as a part of it, while increasing capabilities for citizens.
Okay. Yeah, the surveillance is an interesting topic of maintaining privacy, but also making sure that, you know, you as a provider know what's going on your vehicles. You have a record of what's going on if any incidents happen. I think that, you know, on the one hand, yeah, people don't necessarily want their face all over cameras, but on the other hand, it could really help with that perception of transit, especially if that perception is that transit is not safe.
Right.
And I know that that's something that, like, larger, you know, transit operators like MARTA have certainly implemented, as a lot of surveillance to help with that. Well, this has been really good discussion. Oh, I think somebody else was going to try to jump in.
Yeah, I was just going to jump in real quick and say that obviously there's limited funds to go around, and in this this hypothetical, I would definitely look at putting some money into the workforce side of things, because transportation is one of the biggest barriers to employment. And I know there's lots of individuals that are trying to work in this space, but there's oftentimes you can get somebody trained up, but they can only accept a job, within walking distance, or if they're lucky, biking distance from their community. And in Columbus, we're working with a lot of organizations that are doing good work in those communities, but providing people the ability to move their employment possibility, to expand their employment possibilities, would be a big move. And I know you mentioned earlier about apprenticeships. That's also a very big one, because the school districts are doing an excellent job trying to build work-based learning into their systems and to get people work experience into these careers. But if you can't get a high school junior or senior to the facility, then it's impossible to really do that. I was talking with someone a few weeks ago, and they were telling us that they were looking at putting together an apprenticeship, but for their school district, if they don't have, if the student does not have the ability to drive themselves, they would have to take the bus, which would take an hour to get to the closest bus stop, and then have to walk 3 miles to get to the facility. You're not going to ask a high school senior or junior to do that in order to do some internship or after school work. So I would just throw that hat in the ring if there was a, fictional fund for helping solve some of these issues.
Yeah. Oh, thank you, Connor. I appreciate that.
And then I want to add too that Jim says border community needs with the Columbus Auburn MSA. Riders coming from Alabama into Columbus raise complexities for providing integrated service.
Yeah, that's y'all are right on the line, right between Columbus and Phoenix City, not too far from Auburn. So that does add some complexity, and something I haven't really considered.
Yeah, I think more than a lot of regions, we do have that growing Auburn MSA, Auburn Columbus MSA.
Yeah.
There are a lot of folks come over here from Russell County.
Yeah. Okay. That's good to know. These comments have been absolutely fantastic. We really appreciate the conversation and the feedback. These comments are going to go straight into this needs assessment. You will see them reflected there. We're going to be trying to come up with solutions. If you have more ideas of programs or projects or policies that you think would be beneficial for your region or for the state as a whole, we would love to hear those as well. So I'm going to keep the slide going and let Matt finish it up for us.
Awesome. Well, again, to echo Kirsten, thank you so much for all of your comments and the discussion today. It's really, really helpful for us to better understand the current transit options, like some of the information we did not know. And that's really helpful for us to put in our report. And so we really appreciate that feedback. Just to review our schedule one more time, we are working on the existing conditions assessment and the alternative analysis now, and we will start the development of the draft final report in the coming months. We are targeting July for publishing the draft final report on our website for public comment. Once again, thank you all so much for your participation in the workshop today. Please do not hesitate to reach out to me or to Kirsten for any questions or comments on the information that was shared today. Also, we ask if you did not already do so, please complete our survey, whether you are a provider or a writer. We want to hear from you. And this website is under the GDOT Transit website. So if you go to www.dot.ga.gov/transit, you can find information on the RHST update there. My email is mawilson@dot.ga.gov, and we ask that you send any questions by March 4th, so we have time to respond. With that, again, thank you so much for the time this afternoon, and have a great day.
Great, thank you.
Thank you for your time.